Hey, this is Q Williams RN, and you are listening to the Q Williams YouTube channel. Thanks so much. Today, I want to talk about the coronavirus and where it came from. Where did the coronavirus start? How did it originate? All of the information I will be giving out is to be used for information and facts. This is not medical advice. As is anything on the Q Williams YouTube channel, this is not intended as medical advice. It is to be used for your information. So the coronavirus has been around before. I know people were going crazy over the fact that it says on the back of the Lysol can that it kills coronavirus. Well, that does kill coronavirus because coronavirus is not new. Like a lot of viruses, the coronavirus can mutate, it can change, and it spreads that way. So the other forms of coronavirus that have been present are SARS and MERS. I'm going to go back and talk about SARS first, which originally came about in 2002. SARS is severe acute respiratory distress syndrome. It originated when a bat that was infected a cat, and then that virus was transmitted to a human. MERS, which is Middle Eastern Respiratory Syndrome, also involved a bat infecting a camel, and then the virus was transmitted to humans, and that was in 2012. So COVID-19, which is the current coronavirus, and it is a coronavirus that was discovered in 2019, involves a bat infecting a pangolin, and then the virus being transmitted to humans. And a lot of people may not know, but bats are animal reservoirs. They're animal reservoirs. Bats can harbor viruses that can cross species barriers, which is how these viruses are mutating and being transmitted from animals to humans, and kind of becoming more and more contagious. The coronavirus is extremely contagious, which is why it has people very afraid and kind of nervous about what can happen possibly. Normally, if you get the flu virus or influenza virus, there is like a one-to-one person contact. It means one person gets the flu and then they touch you, they cough on you, you touch something that person had, and then one person is infected. With the coronavirus, one person gets the virus and then 3 people can become infected. And so those 3 people infect 3 more people, and then those 3 people infect 3 more people. Each of those 3 people infects 3 more people, and on and on and on. And so what happens is you have an exponential increase in the number of people infected versus a linear increase with the flu, like a one-to-one person being infected. Originally, it was noted that the coronavirus was transmitted during fecal-oral route. And that means someone with the virus went to the restroom, did what they had to do, didn't wash themselves, clean themselves properly, didn't wash their hands afterwards. They come out of the bathroom, they're touching all kinds of things. Someone else comes in behind that person, do what they do, and then they come out and they're touching things. Or maybe you don't even go behind that person and you don't even know that person's come out and touched all kind of things after they've gone to the bathroom and not washed their hands, and they're just spreading the disease that way. The other way it spreads, of course, is respiratory droplets, which we have all become aware of because everyone is wearing masks. So respiratory droplet transmission involves someone coughing or sneezing, and the droplets can spread as far as 3 to 6 feet. And if you come around someone who's been coughing and sneezing and you're that close to them, you can become infected. It's been said that the virus can survive on surfaces for 24 hours and it can survive in air for 3 hours. I am going to link some information to the World Health Organization and to the Center for Disease Control down below. And thank you for listening and learning more about coronavirus.